Leading cancer researcher Dr. Thomas Seyfried has made a claim that turns the usual story on its head. Most cancers don't begin as genetic destiny. They begin as a problem with energy, a breakdown in how our cells make fuel. For decades, we've been told cancer strikes from deep in our DNA, a roll of the dice we can't control. But what if the real trigger is more basic? What if many cancers could be prevented, slowed, or better managed by protecting the tiny power plants inside our cells, the mitochondria? That's the core of the metabolic theory of cancer, and once you understand it, a lot of things that never quite added up suddenly make sense. Tumors are ravenous. They consume sugar at astonishing rates and ferment it into lactate even when oxygen is available, a pattern first described as the Warburg effect. It's not random. It's a sign that normal respiration has been disrupted and the cell has fallen back on a primitive, less efficient energy pathway. When that shift happens and stays stuck, disease takes root. Here's why this matters right now. In the United States, the American Cancer Society estimates more than 600,000 cancer deaths in 2025, roughly 1,700 every single day and more. More than 2 million new diagnoses. Those aren't just numbers. They're families, friends, and futures. And despite improvements in screening and treatment, survival for several aggressive cancers hasn't budged as much as we hoped. So it's fair to ask, are we missing a big piece of the puzzle? Seyfried's answer is blunt. We are living in a way that punishes our mitochondria. Constant snacking, ultra-processed carbohydrates, late nights, high stress, very little movement. Over time, those habits push insulin up, inflamed tissues, and nudge vulnerable cells toward that fermentation state. The practical flip side is encouraging. Change the fuel, change the environment, and you influence the behavior of those cells. Most tumor cells run on two main fuels, glucose and the amino acid glutamine. Many appear far less capable of using fat-derived ketones. That asymmetry is what metabolic therapy tries to exploit. Lower glucose availability, raise circulating ketones, and you make life easier for healthy cells and harder for abnormal ones. It is not a cure-all, and it is not a replacement for oncology care, but the biology is coherent and increasingly studied. So how do you put this into action safely and intelligently? Start with food, because food is the fastest way to shift your internal chemistry. When you lower sugars and refined starches, think sweet drinks. Pastries, white bread, posture, lower the constant insulin signal that tells the body to store energy. When you replace those calories with real foods that are rich in natural fats and protein, olive oil, avocados, eggs, fish, meat, and build meals around non-starchy vegetables like broccoli, cauliflower, and leafy greens, your body gradually transitions from sugar-dominant to fat-dominant. In that state, your liver produces ketone bodies that most healthy tissues can use efficiently. The point is not to chase a trend. The point is to restore a fuel mix that supports mitochondrial function and keeps inflammation in check. Clinical reviews and early trials suggest ketogenic patterns may help. Some patients tolerate therapy better and may support certain outcomes, though results vary by cancer type and individual. This is exactly where your care team should guide you if you are in treatment. One simple tool helps you see whether your nutrition is doing what you think it's doing, the glucose ketone index, or GKI. It's a ratio derived from a fingerstick glucose reading and a fingerstick ketone reading. Lower numbers indicate deeper nutritional ketosis. Seyfried and colleagues proposed the GKI as a way to quantify and monitor therapeutic ketosis in their framing. Pushing the GKI down is a way to create an unfavorable environment for glycolysis-dependent tumor cells while supporting normal tissues. You do not need to live at very low values forever, and you should not attempt aggressive targets if you are unwell or under treatment without medical supervision. But as a feedback gauge, the GKI can be eye-opening. Many people eating a standard diet discover their ratio sits extremely high. With deliberate dietary changes, that ratio begins to fall. Food alone, though, is only one lever. Movement is the other low-tech, high-leverage tool you control. Contracting muscles are powerful glucose sinks. A 10 to 30-minute walk after meals can flatten the blood sugar spike from that meal and improve insulin sensitivity over time. You do not need to grind. You need to be consistent. If all you do this week is add a brisk 10-minute walk right after the day's largest meal, you are already moving your metabolism in the right direction. Over time, layer in simple strength work to build and preserve muscle, the biggest glucose disposal organ in your body. Diabetes journals fasting is the third lever, and it must be used with respect. Intermittent fasting windows and occasional medically supervised fasts can lower insulin, elevate ketones, and activate cellular housekeeping processes that we tend to suppress with around-the-clock eating. Early studies and pilot trials suggest that fasting strategies, or fasting-mimicking diets, may improve treatment tolerance and modulate metabolic stress in some settings. This is an evolving research area, promising, not definitive. If you are healthy and curious, conservative time-restricted eating, like finishing dinner earlier and giving yourself a genuine overnight fast, can be a gentle way to begin. If you have a diagnosis or are in active care, involve your oncology team before attempting any fasting protocol. Let's make this real and practical for everyday life. Picture tomorrow's plate built around protein, fiber, and healthy fat. An omelette cooked in olive oil with spinach and smoked salmon at breakfast. A large salad with chicken, avocado, olives, and a sharp vinaigrette at lunch. Roasted vegetables and a fatty fish like salmon or mackerel at dinner. Skip the sweet drink, skip the bread basket, and finish the last bite 2 to 3 hours before bed. After meals, put on shoes and walk the block. That one rhythm better fuel, light movement, earlier stop nudges, glucose down and ketones up, and it asks your mitochondria to do what they were designed to do. Over a few weeks, you'll likely notice steadier energy, fewer late-night cravings, and better sleep. Your meter, if you use one, will often confirm what you feel. Now, let's be clear about boundaries. Metabolic strategies are not magic shields. They do not eliminate the need for screening, diagnosis, or evidence-based treatment. What they can do is change the terrain. They can make your internal environment less friendly to runaway glycolysis and chronic inflammation while supporting the healthy tissues you want to protect. That is the spirit of Seyfried's work, not a rejection of medical care, but an insistence that metabolism is a pillar of that care, from prevention to survivorship. Lunghua Chinese medicine. If this perspective resonates, start small and stack wins. Replace the afternoon pastry with nuts and berries. Trade the soft drink for sparkling water. Take the post-meal walk. Push dinner a little earlier and let the overnight fast be real. If you choose to monitor, track morning glucose and occasional ketones, and calculate your GKI once or twice a week to see genuine trends rather than chasing daily noise. If you are on medication for blood sugar or blood pressure, loop in your clinician. Improvements in lifestyle can change your dosage needs quickly. And remember the bigger picture. Population data remind us why prevention matters. The burden of cancer is still immense, but it is not immovable. Every step that lowers chronic inflammation, improves insulin sensitivity, and restores healthy mitochondrial function moves you away from risk. The path is not complicated. It is simply different from the way most of us live by default. Eat foods that love your mitochondria back. Move like it matters, because it does. Give your body time without food so it can repair. Then let your lab numbers and your quality of life be your scoreboard. If this helped you see cancer and metabolism in a new light, tap like so more people find it. Subscribe for more science-based health breakdowns, and drop a comment telling me where you're rewatching from and what change you're restarting this week. Your choices, meal by meal, step by step, are not small. They are the foundation of the healthiest future you can build.